Dr. Murphy, it's so good to see you again. We've got reports that Moderna is now talking a 3-in-1 shot for RSV, COVID, and the flu. But doctor, studies including one co-authored by 9 FDA researchers and scientists are talking about dangerous side effects like myocarditis and pulmonary embolism from COVID vaccines. What do you make of this 3-in-1 vax?
Well, Liz, there is precedent for what they call a trivalent vaccine, where 3 specific diseases are targeted: your measles, mumps, rubella, the MMR shot. And so this is not unexpected. The problem is that, again, we're targeting different populations, but trying to throw it all into one shot. RSV is primarily a pediatric disease. And despite what people say, COVID, so by and large, is not a pediatric disease. And then the flu, which is going to be the third part of that, yeah, it affects some young adults, but really predominantly for older individuals. What we've done, unfortunately, is we've gotten back from the entire purpose of a vaccine, and that's to hit targeted groups, targeted ages of individuals, or targeted groups with certain diseases, and then stepping back to a trivalent vaccine with these different types of disease processes, besides the fact that we're really pointing out now to myocarditis, especially in younger men, or some of the other blood clotting disorders. Really, I'm questioning the need for that type of intervention, really, at this point in time, especially in the age of therapeutics. Because
while you were talking, we were showing disclosures from a study by Mass General, Brigham and Women's Hospital in Massachusetts General up in Boston. They found increased inflammation and cardiac injury in teenagers and young adults. So to your point, it's about targeting the audience. They got vaccinated for COVID. Another study found the Moderna Spikevax has a 2 to 3-fold greater incidence of myocarditis and other heart inflammation after the second dose. But they're saying that's still very rare. What do you think?
Well, it's not rare enough when it happens to you, right? And if you're taking a vaccine that you really honestly don't need, if you're not in one of those targeted populations and you're affected by that myocarditis, then it's a problem for you. Again, you go back to and say it again and again. This is something that should be decided between a doctor and a patient. And I think some of the problems in healthcare institutions in the country these days, going back 2 years, it's all turned political, and there's so much fear-mongering that's gone on. Yes, this is a terrible disease, but generally in targeted populations, not in young adults.
But to your point, there's concern about the vaccine, right? People are worried about it. They want to be safe. People want to do the right thing. They want to be vaccinated. We understand that people want to do the right thing, but they're worried about the vaccine. And now reports that the CDC is identifying hundreds of safety signals for the Moderna and Pfizer vaccines for Bell's palsy, blood clotting, based on the vaccine adverse event reporting system. Now, we know that that is just a red flag early warning system, that it's may not be indicative, but are we talking enough in the media about this? Are we doing enough coverage of this? Is Congress and the NIH and Dr. Fauci talking enough about side effects of the vaccines?
Well, I don't think we're talking much about anything except a speakership in Congress these days. But that said, there are risks to this medicine. And as I said at the beginning, this is a risk and benefit situation. But there are signals. There are signals that are worrisome. Again, these are discussions that we should have with doctors and patients rather than governments itself.
Got it.